Thank you. Really appreciate those comments and know that that's difficult to share with us. And I think sometimes it's difficult when we talk about this problem and you look at the escalation in this problem over the course of the last decade and a half in particular, and we talk about what we try to do about suicide. I think it's hard sometimes to remember that behind every number is a person, is a family, is a network, are many, many people and many lives that are touched in each and every one of these instances. And it is a national problem. There's absolutely no doubt about it. I think part of what is impactful about your comments is how difficult it is for us to have these conversations nationally. I can think of case after case after case where we just have a difficult time saying suicide and having a genuine, thoughtful discussion about it. Is something that is important. We're making progress, but we're not remotely there at this point. So thank you very much for sharing that and being with us today. I'm going to ask for our first set of panelists to come forward, if you would, and I'll let you introduce yourselves rather than me do those introductions. So why don't you go ahead and come forward and let's assemble our first panel. Then I'll let you walk through telling us a little bit about yourselves.
Thank you very much. Good morning, everyone. I'm Ostrovsky, and I am very excited to coordinate and facilitate this panel. We're going to be talking about patterns of risk and the prevention landscape in the suicide space. I'm very lucky to have Dr. Christine Moutier here from the American Foundation for Suicide Prevention and Professor Holly Wilcox from Johns Hopkins University. I will let them also introduce themselves so that they can do their backgrounds justice. I want to set a little bit of context here before we begin. So logistically, each presenter will share for about 20 minutes to give us the context that we need for the next day and a half of discussion and brainstorming. After that, we'll have about 30 minutes of discussion Q&A. I want to strongly encourage you all to stand up, ask questions, offer insights, because I want to build on what Taryn said. Awareness is important. Yes, let's raise awareness, but let's take action and let's think about how we can take the context that we're going to get from these experts and start to move the actions forward. A brief personal note about me. I'm a pediatrician, and I see certainly mental health issues amongst my pediatric patients. But my day job and what I've really committed this chapter of my life to is the addiction space. And I'm the chief executive officer of an organization called Concerted Care Group, where we provide addiction treatment services as well as mental health therapy in addition to primary care. And what instigated my move into this space is my uncle died of an overdose. And that overdose wasn't just because of the crack cocaine and the opiates that were in his system. The overdose was because of the 15 years that, in retrospect, was very clear that he had significant mental health and behavioral health issues, and I, as a clinician, didn't spot it. And I chalked it up to, oh, he's that relative that's just wasting his life away or making bad decisions, when here I am, supposedly an expert on eliminating stigma and evidence-based practice. So I am a culprit in stigma and perpetuating stigma around behavioral health and mental health. And I can now say that because I've had some catharsis over the past 9 months working directly in this space. But I think it's a continual work in progress. And also, we can't separate out just addiction or just mental health or just somatic health. So many of these issues are commingled, not to mention all the upstream health determinants. So I share all of that because this is very personal for me. I think it's very personal for many of us here in the room. And I am very committed to figuring out however we can truly build on what Taryn was imploring us to do, which is take action. Not just talk about it, but work on fixing the systems issues at hand. So without further ado, we've got the actual experts here to give us a little bit of context. Which of you, Holly, you're going first? Yeah, perfect. Great.